Hello everybody, I'm Daniela Presti, I'm Assistant Professor at the Unit of Measurement and Biomedical Instrumentation of University Campus Biomedico of Rome. My tutorial today is titled Wearable Sensor for Cardiorespiratory Monitoring from Design to Data Analysis. In the first part of this tutorial, I will give you some motivation behind the development of wearable sensor for cardiorespiratory monitoring, while in the second part of this tutorial, I will give you some tips like a roadmap to follow to design a successful wearable sensor for the estimation of respiratory rate and the heart rate. But let's start with the first part of this tutorial. As you know, the aging of population is considered the dominant demographic phenomenon of the 21st century. Basically, people worldwide are living longer. However, if on the one hand the aging of population is the crowning achievement of our society, on the other hand is a great challenge. In fact, if the number of elderly people is expected to increase in the next year, also the number of age-related chronic disease will increase, with a significant economic burden on the healthcare ecosystem. For this reason, the development of innovative sensing technology and methodology capable to move care from hospital to home will be necessary to improve the health of people, to improve the care management, and to lower the cost of the healthcare system. This kind of technology will foster the digitalization of the healthcare sector by enabling the continuous monitoring of patients at home. In this scenario, a key enabler is the wearable technology. Wearables are items such as accessory or garment or patch that can be directly worn on the body to detect important information of the human health in an unobtrusive and comfortable way. If we focus on wearable for cardiorespiratory monitoring, we usually refer to wearable to estimate the respiratory rate and the heart rate. The design of wearable for cardiorespiratory monitoring can change in accordance with the body location on which these devices are intended to be worn. Let me say that for sure one of the less unobtrusive wearable devices are the one that can be worn on the chest. I'm referring to smart t-shirt, smart bands, or patch that can be directly attached on the body. This wearable solution usually integrates strain sensor to detect the deformation induced on the chest wall by the breathing activity, or inertial sensor capable of detecting the vibration induced on the chest wall by the cardiac activity in the form of linear acceleration or angular velocity. However, even if less frequently, inertial sensor can be also used to estimate the respiratory rate, and highly sensitive strain sensors, such as the one based on fiber optic, can be used to estimate the heart rate. Of course, the tighter the attachment between the wearable surface and the skin surface, the higher the measurement reliability of this technology. For this reason, over the last year, a lot of effort has been devoted to change the design of wearables from bulky and rigid devices to highly flexible devices. Flexible sensors basically are characterized by very high comfortability, very high skin adaptability, and skin-like appearance. But now let's move to the second part of this tutorial, in which I'm going to share with you my experience in the design of wearable system for cardiorespiratory monitoring. I'm going to mainly focus on the design of a flexible wearable strain sensor for the estimation of the respiratory rate and the heart rate. You have three main steps to follow. First of all, you have to optimize the design of your flexible sensor, and then you have to fabricate your sensor. After that, you have to perform a methodological characterization of your sensor, and finally, you have to compare the capability of your devices in estimating the parameter of interest with the one of a gold standard to better investigate the performance of the developed sensor. But let's start with the design optimization. My suggestion is to develop a finite element model to better understand which shape, which dimension, which mechanical properties of your sensor will be the best one to optimize the response to strain. Here in the slide, for instance, you can see two different shapes usually used to develop a flexible sensor for strain measurements, a dog bone shape and a rectangular shape. As you can see, if you enclose the strain sensor in the central part of this shape, you will have a higher response to strain for the dog bone shape. After that, you have to fabricate your sensor. First of all, you have to give the modeled shape, the optimized shape to your sensor by developing a mold in which you will place the sensor and then you will pour the silicone material. So you have to prepare the silicone material and pour the silicone into the mold with the strain sensor. And finally, after the curing time, you can remove the flexible sensor from your mold. Here you can see an example of a flexible sensor that we have developed in our lab. This is based on fiber optic technology and was used to be attached on the chest wall to detect both respiratory rate and the heart rate. After that, you have to perform a metrological characterization of your flexible sensor, since the flexible substrates can change the response to strain to the sensor enclosed within the flexible matrix. First of all, you have to investigate the response to strain of your sensor. For instance, you can use a tensile testing machine to apply known input to your sensor, and then from the calibration curve you have to estimate the sensitivity of your sensor. After that, you can also investigate the influence of quantities such as temperature and relative humidity on the response of your sensor. In this way, you can understand if you need a compensation of some quantities to optimize the response to your sensor to strain. Moreover, you can also investigate the hysteresis behavior of your sensor by calculating the hysteresis error, since both breathing and heart beating are pseudo-periodic activity. After that, you have to assess the capability of the developed flexible sensor by defining a reference instrument in order to compare the results obtained using our sensor with the one of a gold standard, and by designing a protocol to investigate the performance of our sensor in different conditions, for instance at rest, during a sitting, standing or supine position, or also during activity, for instance during walking or running. Moreover, you can also investigate the performance of your sensor under different breathing conditions such as slow, normal and fast breathing. After that, you have to analyze the raw signal recorded using your sensor in order to estimate the parameter of interest, in our case the respiratory rate and the heart rate. You can choose to perform an analysis in the frequency domain, the FDA analysis, or in the time domain. Let's start with the frequency domain analysis. Here you can see an example in black of a raw signal recorded during breathing, and I will give you some tips about how to analyze this signal to estimate the respiratory rate. But let me say that this process can be generalized to estimate the heart rate or other parameter of interest. So first of all, we have to filter our signal to discard all the contribution not related to the activity of interest, in this case all the frequency contribution not related to breathing. And then we can move in the frequency domain to obtain the spectrum of the signal. From the spectrum of the signal, we can we can calculate the frequency at which the maximum of the power is located, and from this frequency, that is the dominant frequency, by multiplying this frequency by 60, we can obtain the respiratory rate expressed in breath per minute. As regards the time domain analysis, basically again we have to filter our signal to remove all the contribution not related to breathing, and then we should identify peaks on the filtered signal. In case of the estimation of respiratory rate, we can identify end inspiratory peaks or end expiratory peaks, and then After the identification of these peaks by setting some threshold, both in time and amplitude, we can calculate the time elapsing between consecutive peaks, that is the respiratory period, and then from the respiratory period we can estimate the respiratory rates. Basically, we can say that the FDA analysis is faster than the TDA analysis, but give us just one value for each analyzed window. So if you have a longer acquisition, it's better to split your signal into several windows, and for each window obtain the value of frequency, the value of respiratory rate. As regard the time domain, for sure, you have more than one value for each analyzed window. In fact, you can identify peaks and estimate the breath by breath or the bit by bit value over the analyzed window. In this case, it's really important to define threshold to automatically identify peaks on the signal. For the FDA analysis, you don't need a very high quality signal, while for the TDA, you need that. A few words about how you can move in case of motion, how you can behave, which kind of analysis you can perform, how your wearable should change if you want to estimate the respiratory rate during motion. Basically, my suggestion is to develop a multi-sensor wearable. So I suggest to not use only a single sensor in your wearable, but to use multiple sensors, and also to integrate other kind of sensors such as an accelerometer by performing a multimodal approach, by using a multimodal approach to discharge all the contribution related to motion and not related to the activity of interest. So in case of motion, it's better to use a multi-sensor approach combined with a multimodal approach. So to summing up, the roadmap that I share with you consists of 3 main steps: design and fabrication, metrological characterization, and estimation of respiratory rate and heart rate. This parameter can be estimated or in the frequency domain or in the time domain. And if you need to use your wearable not only in resting condition but also during motion, my suggestion is to move from a single sensor approach to a multi-sensor and multimodal approach. Let me say that if you want to use strain sensor for the estimation of the heart rate, it's better to use, even in case of resting condition, a multi-sensor approach, since you are interested in detecting very small deformation from the chest wall surface. So that's all. I would like to thank you again, the EMS Society, for this possibility. If you have question, curiosity, do not hesitate to contact me using the email address that you can find in the final slide of this tutorial. So thank you again and have a nice day.